I'm Dr. Himal Gajjar. I'm a radiologist at SCP Radiology.
My name is Anneke Knoesen. I am a radiographer at SCP Panorama.
So the barium swallow plays a critical role in making a diagnosis in a patient with symptoms of the upper GI tract. For example, if there is dysphagia or difficulty in swallowing, that could be from a mechanical cause, and we can confirm that on the barium swallow study, and then also try and assess the cause for the mechanical obstruction. And making that diagnosis is critical for the specialist, because their further management of how to deal with that problem, how to investigate it further, hinges on the barium swallow. Another example would be if someone has reflux, there may be a hiatal hernia. This is where the stomach moves up into the chest. So it may divert the treatment to a surgical plan instead of just with medication, or it may be a more aggressive medical treatment pathway.
So the screening machine we can use for normal x-rays as well. It's the same type of machine. When we do screening cases, we just do screening instead of normal x-rays. There's always two people in the room. A radiographer will be assisting the patient, and then the radiologist will be standing behind the screens taking the x-rays.
So X-rays, as we all know, are one of the oldest ways of imaging the human body. But with fluoroscopy, we actually use X-rays to get a real-time image, a movie X-ray of the process as it occurs. And this is a dynamic X-ray process. We can watch the contrast as it's flowing and in different positions and simulate the symptoms that you have and try and work out the cause for those. There are two components to the study. The one is the actual structure, the anatomy of the throat, the esophagus, and the junction between the esophagus and the stomach. And the other is the functional working of those structures. So typically the study is done in different positions, and we'll give a X-ray dye or contrast dye, an inert material that one swallows, and we will watch real time how the contrast passes, if there are any obstructions. If they're mechanical, we'll try and assess the cause of the obstruction, and also look at the function of the esophagus. And we try and analyze how it's gone wrong, how severe it is, and that helps the specialist guide your treatment.
The patient will come through reception, and the radiographer will greet them there and take them through to a dressing room. So from there we take them into the X-ray room. We will do a control image just to check their anatomy, see if everything is clear. So then the radiologist will join us for the examination. So how we usually do it for any contrast medium swallow is we have a cup, we give the patient the cup in their hand with the contrast medium, and the radiologist will instruct them to take a mouthful but keep it in their mouth first. And then as soon as they are ready with the X-ray machine, they will ask the patient to swallow. And as the patient swallows, the doctor will screen, follow it all the way down into the stomach, and then he will instruct us as well if we need to turn the patient in different positions. Sometimes we have the patient lie down as well, turn onto the tummy, all depending on what we need to see. And as soon as the radiologist is happy with everything that we have done, they will tell us that we are finished, and then the patient can get dressed again.